Hello, hi, it's Dr. Erica. Thank you for joining me on this particular topic. I am pharmd, pharmacist for close to 10 years now, and I am going to briefly talk about one particular medication used for bacterial infection in usually females. It's called Flagyl, also known as metronidazole. Metronidazole is um, a mobic infection, and it also helps treat the diarrhea and due to gut flora. Again, it is an anti-infective medication, and it comes in two different strengths. Here, FDA approved in the states, and that's going to be 500 milligram as well as the 250 milligram, and it is indicated for uh, infection, vaginal infection, bacterial infection, uh, in the for female use typically, and um, some some of the drug interactions to avoid is going to be use with alcohol. Use with alcohol will increase toxicity levels of the metronidazole, leading to emergency cases where uh, the uh, the patient will have to be actually taken to the emergency department due to that actual that alcohol and metronidazole toxicity that's well known. So usually when you get a prescription for metronidazole or Flagyl, you're going to get a consultation from the pharmacist that will tell you, okay, refrain from taking alcohol while using this medication just because it's going to cause toxicity and therefore can cause a fatality ultimately. So do avoid that. Okay, and again, it comes in two different tablet strengths of 250 and also 500 milligram. And it is coupled with another medication in its class called tinidazole. Tinidazole is a medication that I have personally had taken at one point. Um, it is a little bit stronger than the metronidazole, and so it works very effectively for me. And again, it has um, that same profile pretty much to use safely, and it comes in the metronidazole. Uh, talk about that. It comes in two different strengths, 250 and 500 milligram, and then it also comes in a capsule form of 375 milligram, extended release form of 750 milligram, and it's available as an injectable and comes in a powder for injectable as well. So it comes IV and it comes as a powder form. Okay, so doctors may prescribe 750 milligrams 3 times a day for 5 to 10 days for intestinal amoebiasis or amoebiasis, and then liver abscess. The doctor may recommend 500 milligram to 750 milligram 3 times a day for 5 to 10 days. And then also, again, mainly you see in pharmacy dispensing treatment for bacterial vaginosis. Bacterial vaginosis is again a bacterial infection in the vagina that usually requires this particular medication, and stronger medications are available in the same class. Okay, so the directions for the bacterial vaginosis is to take one Flagyl ER tablet for 7 days by mouth. Okay, and then also symptomatic and asymptomatic trichomoniasis, and then also it's good for anaerobic bacterial infections, and also pre-surgery colorectal surgical procedures will require a Flagyl prophylaxis using the IV formulations that I mentioned earlier. So do be on the lookout for its indications. That's going to be the bacterial vaginosis. That's going to be the prophylaxis of colorectal surgery. Also, it's going to be for acute intestinal amoeboiasis. And then also, it's going to be for trichomoniasis or trichomoniasis, I should say. And it's usually taken for 7 days therapy. 7 days therapy is what it's usually given for duration, and then it's recommended to take for full course of the 7 days. Do not stop using it earlier than that. If there is side effects or adverse effects that you may be feeling, let your doctor know so they can switch to something that is more tolerable. Also, you may take it with food or milk. If there is a stomach upset or GI upset that may occur, and also store it away from sunlight and from children. And if there's a dose that is missed, take it as soon as possible if you can remember. But if it's closer to the time of the next dose, then just miss that dose, skip it, and return to your regular dosing schedule. But do not double up on this particular medication at all. Don't skip a dose unless it's very close to the next dose, okay? So that is an option. Also, drug interactions. This particular medication interacts with barbiturates, also warfarin or Coumadin. So INR should be examined during the 7-day to 10-day use of this medication. The warfarin is an anticoagulant, and so it's very important that the INR is within proper range. Okay, and then also, this medication is contraindicated in patients who have the allergy to metronidazole or any other nitroimidazole derivative or nitroimidazole class. And then also is contraindicated in patients who have in patients with trichomoniasis during the first trimester of gestation. Okay, and then it's recommended to use with caution in patients with organic CNS diseases or severe hepatic impairment. Again, let me repeat that. Use with caution in patients with organic CNS diseases or severe hepatic impairment. Do not refrigerate the IV solution, and its gestation pregnancy category is category B. Okay, so it's safely to use in pregnancy. Now, I'll go over some of the adverse effects. What I went over was some precautions. Now, I'll go over the adverse effects, and that includes anorexia, nausea, vomiting, diarrhea, GI upset, like I mentioned earlier. So that's why it's best to take with the meal or with milk. Convulsive seizures and peripheral neuropathy, abdominal cramping, headache, metallic taste in the mouth after using the medication, and dysuria can be one of the side effects. This medication does work very quickly. The symptoms of vaginosis will dissipate. However, the continuation of the medication should be to its completion. Again, use to completion. Although symptom relief may occur much earlier, that does not always mean that the bacterial infection has completely cleared. Okay, so we do want to be on the lookout for side effects and also those GI upset episodes. And then we want to again avoid alcohol use because it can cause a reaction that could be detrimental or fatal. So we do want to avoid that interaction. So do be aware. Now, metronidazole is usually prescribed. Of course, it's prescribed, and then there's our discounted prices that do come with metronidazole. This medication is a economically accepted medication. I do recommend it if needed, and it is usually at a discounted price for maybe under $5 on a special. So I do recommend it for as an antibiotic for patients who may not be actually able to have this prescription covered through prescription insurance. So it is actually safe, effective, and it's economically acceptable in my book. So I would give this product 10 out of 10. And yes, I recommend it for those who need it. So that is my take on Flagyl or metronidazole. And it's very convenient, comes in convenient formulations, and it's only for like a 7-day dose. So that is very convenient as well. The only thing is that the tablets can be a little, the tablets are about that size, I would say. Can we see? The tablets are about that size, and the metallic taste and the structure can be a obstacle when taking the metronidazole, but the benefit outweighs that risk. So I do recommend it. So that's what I want to go over on this particular video is metronidazole for usually, again, prophylaxis therapy and also treatment. Thank you for joining me. I'm Dr. Erica, and I hope to see you on our next video that is soon to come up. And please like, share, and subscribe. If you would, leave any comments that you may have about any topics that you want to discuss. Please hit that subscribe button that's in the corner right there. And I look to hear from everyone. And please binge watch on previous videos that I have. And if you don't want to binge watch, or if you have one particular item in mind that you would like to learn about, please leave a comment and I'll be happy to research and go over any topics that's more relevant for you. So thank you for joining me. Thank you. Bye-bye.